Welcome to HMSA's annual Akamai Advantage Provider Training Session. This session is hosted by HMSA's Provider Training Unit. I am Valerie Sonoda, one of your 4 speakers you will hear from today. First, we will share information about HMSA's 2018 benefit plans, so you will have a preview of changes. We will also discuss Medicare plan enrollment periods. Next, we will talk about HMSA's new plan, Essential Advantage, our new HMO plan starting January 2018. Next, we will discuss HMSA's Dual Care product effective January 1st, 2016, and how HMSA supports its Dual Care members through HMSA's model of care, and the use of tools and resources to assist the patient with navigating the healthcare environment. There are assessments CMS requires providers to complete for this most vulnerable population, so we will review the care of older adults to help us meet this requirement. Lastly, we will review for you some important tips for your practice as it relates to Medicare programs that enhance the doctor-patient relationship. So let's get started. At this time, I would like to introduce our first speaker, Leslie Silva. Leslie?
Hi, my name is Leslie Silva, and I'm from the sales area at HMSA, and today I'm here to talk to you about the 2018 Akamai Advantage plans available on Oahu and the neighbor islands. On Oahu, in 2018, we will be offering Akamai Advantage Complete and Complete Plus. These are Preferred Provider Organization Plans, or PPO plans. New in 2018 is Essential Advantage. It is an HMO plan, a health maintenance organization, that will be offered to people on Oahu. So we're really excited about that plan. We'll tell you more about it in just a moment. For our neighbor islands, we offer Standard and Standard Plus PPO plans both. Essential Advantage will not be available in 2018 on the neighbor islands. And across the state, on Oahu and the neighbor islands, we offer Akamai Advantage Dual Care, a preferred provider organization dual special needs plan for people who have both Medicare and Medicaid. All of our plans are comprehensive. They include all original Medicare benefits plus prescription drug coverage. So it's a one-stop shop for all of the plans in the Akamai Advantage family. Again, for Essential Advantage, because it is an HMO, you will be working with a network of providers from Hawaii Pacific Health. There are more than 800 providers that you can choose from to receive your care. And with this plan, it will be important to remember that members must select a primary care physician in order to manage their health care. They will work with this PCP for all referred services. And that's a big difference between the Akamai PPO plans and HMO plans. PPO plans can self-refer. HMO plans will have to go through a PCP for all referred services. Why choose Akamai Advantage? Our members have access to a large statewide provider network for our PPO plans. We have over 5,000 participating providers in our network statewide, and that includes all the major hospitals with the exception of Kaiser and Tripler on Oahu. For Essential Advantage, our HMO plan, members work with Hawaii Pacific Health and their 800 plus providers. So there's a good possibility that people can keep their doctors, and we always suggest that they check with their doctors first to make sure that they're participating in our networks. All of our plans offer comprehensive benefits, all the benefits of original Medicare, prescription drug coverage, and some value-added benefits that I will show you in just a moment. So it is like a one-stop shop. All plans also provide financial protection in the event of a catastrophic illness or injury. Our members will have their out-of-pocket costs for covered Medicare benefits limited in the event of a catastrophic year. So there's great peace of mind, and I will show you those limits in just a moment as well. And wherever possible, we like to give our members predictable costs. That means that we would give them a fixed dollar amount for many of the services, because it's easy to remember a fixed dollar amount versus a percentage, having to calculate that. Let's take a look now at the 2018 Akamai Advantage plans on Oahu. We'll look at the benefit highlights of these plans, Complete and Complete Plus, and our new HMO Essential Advantage, starting with the premium. Great news this year for Akamai Advantage Complete. It will be offered at $57 a month. Currently, it's being offered at $70, so there's a reduction there. For Complete Plus, it will be offered at $147. Currently, it's offered at $158. Essential Advantage will be $20 a month. The maximum out-of-pocket benefit, and that is the financial safety net that we talked about just a moment ago, here are the limits. If somebody goes to an in-network provider, one of the 5,000 providers or the 800 providers for our HMO network, then they will pay for Complete no more than $6,700 for Medicare-covered A and B services. For Complete Plus, that would be $3,400 annually for in-network care. For Essential Advantage, if they stay within their network, their limit will be $5,000, again for Medicare-covered A and B services in a calendar year. These numbers for Complete and Complete Plus remain the same as it is today, so they have not been raised for 2018. Now for our PPO plans, Complete and Complete Plus, members can self-refer, and they can also go outside of our participating network and see non-participating providers as well. So when they do that, they have combined services in and out of network. The thresholds are slightly higher. So for Complete, the annual maximum out-of-pocket will be $10,000. For Complete Plus, it's $5,100. Again, these thresholds will not change in 2018. You'll note for Essential Advantage, there is no benefit for out-of-network services, since with this plan, they must stay within the Essential Advantage network. For primary care visits, we have fixed dollar amounts. For Complete, $30 per visit. For Complete Plus, $10 per visit. Now here we have a reduction for our members. Currently, a PCP visit for Complete is $35, and for Complete Plus, it's $15. So this is going to be lowered in 2018, hopefully getting people to work with their PCP and seeing their PCP for care. For Essential Advantage, they will pay $20 for a PCP visit. Specialty visits, $50 for Complete per visit, $30 for Complete Plus. There's no change in 2018 to these amounts. And for Essential Advantage, it's $50 per visit to a specialist. For our fitness benefit, in 2018, we'll continue to offer our free gym memberships, but we will have a change in vendor. Currently, we're working with Silver Sneakers. In 2018, we have a new vendor, Silver and Fit. The reason we have changed our vendor is because we find that Silver and Fit not only offers free gym membership to 24-hour fitness and Curves locations, but they also offer the YMCA and the YWCA, which are very important venues to our members. So we're really happy to be able to offer that to our members in 2018. Silver and Fit also offers a wide range of home health kits because not all seniors are comfortable going to the gym. So our members will be entitled to 2 home kits per year. And again, there are 20 plus kits that they can choose from. So we're really excited about Silver and Fit, and that benefit is offered across the board on all Akamai Advantage plans on Oahu. Inpatient hospital, there are no changes to the fixed copayment amounts that are currently being offered in 2017. These amounts will remain the same in 2018, so that's good news for our members as well. And you may have noticed that Essential Advantage mirrors Complete. So if you wanted to find a plan that is similar to Essential Advantage, you'll find that when you look at Akamai Advantage Complete. Annual wellness visits and other health screenings continue to be a benefit in 2018. Members do not pay anything out of pocket when they work with their primary care doctor to receive these benefits, like their annual flu shots, pneumococcal vaccines, cancer and diabetes screenings as well. This is no change from 2017. Outpatient services and surgery, this is a benefit for the use of a same-day surgical center. The benefit in 2018 remains as it is today, with a $150 deductible for members under Complete and Essential Advantage. Once the deductible is met, then for an inpatient facility, they will pay a 20% coinsurance. Complete Plus does not have a deductible. Instead, members just pay a 20% coinsurance for an in-network facility. For ambulance, whether it's ground or air, the benefit is going up in 2018. Currently, members pay $200 per trip. For Complete, it will be $250. Complete Plus, $225, and Essential Advantage, $250 per trip. Routine eye exams, these are not benefits under Medicare, but we offer them to our members. They can go in to get their eyes checked for prescriptions, just to check their glasses. In 2018, there are fixed co-payments for these services, and happily, we're able to lower these co-payments. For Complete, currently members pay $35. In 2018, they will pay $30 for routine eye exam, one per year. Complete Plus currently pays $15 for this visit. In 2018, they will pay $10. And Essential Advantage, it will be $20 for a routine eye exam, and all of these are available one per year. Let's take a look now at the Neighbor Island plans, starting with the premium. For Standard, currently being offered at $153, it will be offered at $92 a month. Standard Plus, currently offered at $202 a month, will be offered at $192 a month. So these premiums have gone down as well. The maximum out-of-pocket financial safety net, these remain just as it is for Oahu, and there's no change in 2018. So the amounts are $6,700 for Standard and $3,400 for Standard Plus in-network maximum out-of-pocket. Combined MOOPs, when they go out of network, it stays the same at $10,000 for Standard and $5,100 for Standard Plus. The primary care visits also going down for our Neighbor Island members. Currently being offered at $35 for Standard, it will be $30 a visit in 2018. And Standard Plus, currently $15, it will be $10 per visit. Specialty visits remain as it is today, $50 for Standard and $40 for Standard Plus. Inpatient hospital stay remains as is in 2017, no change to the members out of pocket for this covered benefit. Again, there's no Essential Advantage offered on the Neighbor Islands in 2018. It is being offered only to people residing on Oahu in Honolulu County. Annual wellness visit and preventive services are being offered at $0 for both plans, no change. For outpatient services and surgery, there is no change in 2018. There is a $150 deductible for Standard, and then members pay a 20% coinsurance for an in-network facility. For Standard Plus, no deductible, members pay 20% coinsurance. For ambulance, it's $250 a trip for Standard and $225 for Standard Plus. Again, these have gone up from current $200 copayment. Routine eye exams are offered to our Neighbor Island members as well, and these have gone down in 2018. It'll be $30 for Standard, down from $35, and Standard Plus $10. Currently, members are paying $15. They are entitled to one routine eye exam per year. The fitness benefit is new to our Neighbor Islands in 2018, and we will be offering Silver and Fit to Standard and Standard Plus members. So we're excited about this new benefit. Let's look now at 2018 Akamai Advantage Dual Care, which is available across the state on all islands. The premium remains at $0, no change. The maximum out-of-pocket financial protection is $6,700. That's the most that a dual care member will pay for their Medicare covered services. Medical benefits that are covered by Medicare, most services at a $0 cost share, no change from current benefit levels. Part D, prescription drug benefits, there are no deductibles for dual care, And the cost sharing, again, will depend on the list level of the member, and that does not change in 2018. There is no fitness benefit for dual care. So there's no silver and fit for dual care members. That is as it is today, so there's no change. Routine vision and eyewear, there is no benefit under dual care for this service, as we have it for all of our other Akamai Advantage plans. This is not a change, for currently there is no routine vision available under dual care. For dental, and these are non-Medicare covered services, we continue to offer the basic services, the exams and the cleanings. Those are the same, as well as the denture benefits that you see here. New in 2018, we will be adding benefits for fillings, root canals, periodontal scaling and root planing, and also the plan will pay up to $1,500 per year, and that's an increase from the current level of $1,000. Now, it's important that you know too that currently the plan covers additional enhanced dental benefits for members that have diabetes, coronary artery disease, oral cancer, or women who are pregnant. In 2018, these enhanced dental benefits will be removed, and we are replacing instead or adding to the plan these new benefits that we just covered. I'd like to introduce now HMSA Senior Pharmacist Wendell Omaye.
Hi, this is Wendell from Pharmacy Management. I'll be going over some formulary benefits for the Medicare Part D plans. Here we wanted to highlight the mail order benefit for the Wahoo plans. It's a great benefit for the members, and so we really wanted to show this information. For Tier 1 and Tier 2 generics, it's just one copay for a 90-day supply. Tier 3 and Tier 4 drugs, it's two copays for a 90-day supply. The easiest way to sign up for mail order benefit is to call the number. That way the customer service representative can help the physician or the member sign up for mail order benefits. Again, on this slide, we wanted to show the mail order benefits, which is similar to the Oahu plan for the neighbor island plans. One copay for Tier 1 and Tier 2 drugs for a 90-day supply. Tier 3 and Tier 4 brands, it's two copays for a 90-day supply. And you use the same phone number here to call up to sign up for mail order benefits. This is all the plans that we have for Medicare Part D. We wanted to show this information. The formulary list of drugs is the same for all the plans, so it's easy to remember. The copays for this year will not be changing compared to next year. It's going to be the same copays for 2018. We have 5 tiers for our formulary. Tier 1 and Tier 2 are the generic tiers. The basic difference between Tier 1 and Tier 2 is the cost of the medication. So if the cost of the generic is $15 or less, it ends up in Tier 1. If it's higher than $15, it moves up to Tier 2. Tier 1 also has the adherence medication drugs, which are the statins for cholesterol, the diabetic generic drugs, and also the ACE and ARBs used for high blood pressure. Tier 5 has the highest copay. These are our specialty drugs. Usually these are the drugs used for cancer, rare niche diseases such as cystic fibrosis, pulmonary arterial hypertension, and that's why they have the highest copay for the drugs in the formulary. On this slide, we wanted to show in 2018 the drugs that are going to be moving to non-formulary status. Most of these drugs have a generic, and so the generic is on the formulary, and that's why the brand is moving off. Effient, the first drug listed, does have alternatives, Brilinta and clopidogrel, but it also is going to be going generic, so we expect the generic to be added to the formulary for the members to use. The biggest disruption we see is going to be for Lantus. Lantus is going to be moving to non-formulary, but there is an alternative on the formulary, Basaglar. It's a similar type of insulin, and it's convertible to the Lantus dosage. Everything else is going to be going generic, and that's why the brands are being moved off. We have a couple of drugs moving from Tier 3 to Tier 4. Dexalent, it's a proton pump inhibitor. There are alternatives on the formulary. They're generic. There are also OTC drugs available for the members to use to help them save some money if they want to preserve their drug rider benefits for Medicare Part D. Pradaxa is another brand drug that is going to be moving from Tier 3 to Tier 4. We have Eliquis and Xarelto on the formulary as alternatives. Relpax used for migraine headaches. There are generic alternatives for the drug, But this drug is also going to be going generic this year, and we expect the generic to be added to the formulary. So the generic alternative for Relpax is most likely going to be on the formulary as an alternative. On this slide, we wanted to show you some positive changes for some drugs on our formulary. We have a couple of generics moving down to Tier 1 because of the cost going down, and that's great for the members. They'll have these generics available for them at a Tier 1 copay instead of Tier 2. We also have some brands, Eliquis and Trulicity, moving from Tier 4 to Tier 3, so this will be a lower copay in 2018 for the members for these drugs if they're on these medications next year.
My name is Leslie Silva. So the Medicare annual enrollment period is October 15th through December 7th of this year. This is a time when you can make changes to your health plan. You can either stay put in the plan that you're in now, or you can go from one Medicare plan to another. You can switch, for example, from Complete to Complete Plus or Standard to Standard Plus. You can come to HMSA from another Medicare Advantage plan, or you can choose to go from a Medicare Advantage plan back to Original Medicare. This is the time that Medicare will allow you to make that change, and your changes will become effective January 1 of 2018. At this time, I'd like to introduce Val Sonoda.
Thank you, Leslie. Next, we'll talk about the Essentia Advantage, our new HMO plan that we will be launching in January 2018. We are pleased to present HMSA's new HMO plan, Essentia Advantage, to you. This plan offers your patients on Oahu with a low premium per month as well as drug coverage based on HMSA's formulary. We believe our members can benefit from maintaining their well-being, so under HMSA's Essentia Advantage plan, members will have access to HMSA's Silver and Fit program that allows access to facilities such as 24-hour fitness, Curves, YMCA, etc. Our members will also receive a home fitness kit option and rewards. Here we show you the eligibility under our new Essentia Advantage HMO plan. It has the same eligibility requirements as our Oahu Akamai Advantage Complete and Complete Plus, such as the member must have Medicare Part A and B, the member cannot have ESRD with some exceptions, the member must reside in the city and county of Honolulu, and must continue to pay their Part B premium in addition to the Essentia Advantage premium. Now here's an example of what the Essentia Advantage plan membership card will look like. At the top right-hand corner, you will see printed Essentia Advantage HMO. In the middle, you'll see coverage code Medical T-C with Part D coverage code 885. Similar to verifying other HMSA plan eligibility, you are able to verify Essentia Advantage member eligibility using HHIN. Log in when you're at the HMSA provider portal. Next, we will talk about prior authorizations under Essentia Advantage. Essentia Advantage has the same prior authorizations required for some services as the Akamai Advantage PPO plans. A reminder is that a prior authorization is a process through which the provider is required to obtain advance approval from HMSA to cover a service. A second reminder is to submit a pre-service determination for services to be provided by a non-contracting provider. An example would be a referral to a non-contracting laboratory. Next, let's talk about referrals. Referrals are required from a primary care provider or PCP for in-network services. Hawaii Health Partners will monitor these referrals with their systems. Referrals are also required from a primary care provider for out-of-network services, except for urgent and emergency services. Hawaii Health Partners and HMSA will monitor these referrals, and claims will only process when an approved referral in HMSA systems exists. A gentle reminder, a referral is necessary to see any provider or specialist other than the primary care physician, if the service is to be covered by the Essentia Advantage plan. Here we list for you services that do not require a referral. On the left are in-network services that do not require a referral. On the right are out-of-network services that do not require a referral, such as ambulance, emergency services, urgent care, and kidney dialysis services that you get at a Medicare certified dialysis facility. Here we talk about claims filing and billing. Providers should bill HMSA Essential Advantage plan members for coinsurance, copayments, or deductibles for medical services rendered. Providers should file their claims to HMSA Essential Advantage HMO plan at the following addresses. For professional services, file to P.O. Box 44500, Honolulu, Hawaii 96804. For facility claims, file P.O. Box 32700, Honolulu, Hawaii 96803. Here we'll talk about HMSA Akamai Advantage Dual Care. We'll help you to identify a D-SNP member, how to verify eligibility, and learn more detail about HMSA's Model of Care program. Here's an example of the Akamai Advantage Dual Care membership card. The plan name appears at the top right corner of the front of the card. There is generally no member premium after the low-income subsidy is obtained. Akamai Advantage Dual Care Plan claims filing is as follows. Providers should not bill HMSA Akamai Advantage Dual Care Plan members for coinsurance, copayments, or deductibles for medical services. File claims to HMSA Akamai Advantage Dual Care Plan first, then bill HMSA Quest Integration second. File claims to HMSA Akamai Advantage Dual Care Plan first, then bill other Quest Integration Plan second. Benefits covered by Quest Integration that are not covered by Original Medicare should only be billed to Quest Integration and not to Akamai Advantage Dual Care Plan. Let's talk a little bit about the Qualified Medicare Beneficiary, commonly referred to as QMB. There is a law that went into effect on January 2016 called the Balanced Billing Law. Under this law, the QMB program is a Medicare savings program that exempts Medicare beneficiaries from Medicare cost-sharing liability. You are to ensure that your billing software and staff exempt QMB or QMB Plus patients from Medicare cost-share billing. Medicare Advantage providers are prohibited from discriminating against patients based on their QMB status. Here we've provided you a URL to identify if your patient is a QMB or a QMB Plus individual. Now let's talk about the care management support under HMSA Dual Special Needs Plan. Here we describe for you the model of care. With this member at the center, HMSA has formed three components to support the Akamai Advantage Dual Care member. First, we'll start off with the Health Risk Assessment, or HRA, develop an Individualized Care Plan, ICP, and work with an Interdisciplinary Care Team, or ICT. We'll get into a little bit more detail further on. This is a very fragile population. It is our goal to improve access to essential services such as medical and behavioral health care and social services. We want to improve access for our dual members to affordable care and preventative health services. Coordination of care through assignment of an HMSA care manager is essential to helping to improve coordination. We want to improve seamless transitions of care across healthcare settings, providers, and health services. We also want to make sure that we use appropriate services to improve health outcomes. Under the model of care, we want to be able to support your most vulnerable patients. So we have stratified the population into three categories. This is determined by the health risk assessment and the clinical judgment of HMSA's medical staff. At the top is the most vulnerable population. Some examples of the criteria that we use to identify the most vulnerable is 5 or more chronic comorbid conditions such as diabetes, congestive heart failure, hypertension, etc. If the patient has a terminal condition, or whether they have had 5 or more ER visits within the past 6 months. Severe dementia is another example of determining the most vulnerable. Next is the somewhat vulnerable, and lastly is the least vulnerable. These stratification levels helps HMSA to identify the best method of communicating with this population. Let's talk a little bit more about the health risk assessment and how it helps to develop the individualized care plan. The HRA is conducted by HMSA Care Manager or a PCP. It is done initially within the first 90 days of enrollment. Then we reassess at least annually just in case there were changes or any new health events. We use the information to risk stratify. Remember those 3 different stratification levels we discussed earlier. That will determine the methodology in which we will communicate. For the most vulnerable patient, we will communicate via in-person. Our care management staff will go out to the patient and work with that patient face-to-face. Somewhat vulnerable patients are usually handled telephonically, and least vulnerable patients receive health tips and information via mail. All of this is used to formulate an individual care plan, or ICP. On the right, we describe for you how that individualized care plan is developed. Now, based on the HRA results, HMSA will then use its aerial algorithms and clinical judgment, will obtain input from the interdisciplinary care team, and will modify as needed. Once completed, we'll communicate to our DSNP member, their primary care provider, and members of the ICT team. We'll also share during care transitions. Now let's take a deeper look at the interdisciplinary care team, or ICT. It is important to remember the composition of the team is individualized according to the member's needs and preference. The member is at the top, and to support the member, HMSA has assigned core team members. There is a HMSA service coordinator, an HMSA medical director, and the member's primary care physician. Now, examples of other team members that the member may want to include is a family member or a caregiver. Maybe they'd like to include their specialists or a dietitian, or maybe their neighborhood pharmacist, a gerontologist, or behavioral health. This is all determined by the dual care member. Now that we've provided you with information on HMSA's dual care special needs plan, and we have educated you on HMSA's model of care, we'd like to ask you to complete the provider attestation for model of care training. You are required to attest to CMS that you have received this training. Simply click on the PDF that's in the Provider Resource Center library, print, check the areas that applies to your practice, sign, date, and email to the email address listed on the attestation form. Now, some important HMSA provider reminders. Please notify HMSA of changes in your practice, such as a practice location address if you've moved, or whether your appointment phone number has changed, if there is a change in your patient acceptance status, or if your email to your practice has changed, and even the hours of operation. Be sure to notify HMSA 30 days in advance of any change in practice. You can do so by calling our phone number listed here on Oahu and a toll-free number here for neighbor islands. Or you can mail your changes to HMSA at the address listed here in this slide, or email to us. Timely notification to HMSA will ensure payments and correspondence are sent to the correct address, and that we market your practice using the correct address in our provider directory. To further assist you, we have provided you a list of provider resources, the URL to HMSA Provider eLibrary, phone numbers here on Oahu as well as neighbor islands, and fax numbers to our care managers, and phone and fax numbers to HMSA Provider Services here on Oahu as well as our neighbor islands. Next, we'll take a look at CMS rules for provider practices that you need to know. First, provider practices need to remember that you are required to complete Medicare fraud, waste, and abuse training annually. Here we provide you with the URL that gives you direct links to complete Medicare's compliance training. Next, I'd like to introduce Peter Wong, who will talk about other CMS rules provider practices need to know. Peter?
My name is Peter Wong. Now I'll be going over some rules providers need to know, some of the do's and don'ts. Some of the do's: you may, but you are not required to, provide the names of plan sponsors that you contract with or participate. You may also help patients apply for the low-income subsidy. You can make plan marketing materials available in common areas. If you display marketing materials from some plans, you have to accept requests from all plans you participate with. You may refer patients to other sources of information such as the State Health Insurance Assistance Program, State Medicaid Office, and Social Security Office, or CMS website at medicare.gov or 1-800-MEDICARE. You may share information with patients from CMS website, including the Medicare and You Handbook or Medicare Options Compare, or other documents that were written by or previously approved by CMS. Here are some things you may not do. Offer anything of value to induce plan enrollees to select you as their provider. Offer inducements to persuade beneficiaries to enroll in a particular plan or organization. Conduct health screenings when distributing information to patients. You may not steer beneficiaries in any way to a limited number of plans. Mail marketing materials on behalf of plans. Offer sales or appointment forms. Accept enrollment applications. Make phone calls or direct, urge, or attempt to persuade beneficiaries to enroll in a specific plan based on financial or any other interests of the provider.
Thank you, Peter. On behalf of HMSA, we'd like to thank you for joining us today and watching this video. Please remember to complete the Model of Care attestation form found on HMSA Provider Resource Center. We'd like to thank you for your services to HMSA members and your commitment to maintaining a sustainable healthcare system in Hawaii. Mahalo.